All right, guys. Part two, why I became an addiction doctor. Um, if you haven't watched part one, go ahead and do it. It basically tells the story of why I went into medical school, how I got in, etc. Um, so let's fast forward. I'm in medical school. All right. First 6 weeks, hardest 6 weeks of my life. I was getting up 2 hours before class, study during the breaks, go home from school, study. My wife would come home, we'd eat dinner, I'd go back to study for 2 hours after she went to bed. I repeated this every day for 6 weeks. I was miserable, burning out quick. And then I had the first test. And I walked out of that room with a cold sweat dripping over my face. I saw my buddy Jeff. He was over on the sidewalk. He was smoking a cigarette. And I went over, Jeff, give me one of those, man. I'm not even a smoker, but I took a cigarette and I smoked with Jeff. And we talked about what we were going to do with our lives now that we had flunked out of medical school. So that was a Friday. I had to sweat it out over the weekend. I get my grades back Monday. And I realized something. I see my grade. Hey, it wasn't as bad as I thought. And I realized I could study a lot less and still pass. And maybe that's not the kind of thing you want to hear from your doctor, but it was a lifesaver for me. And it turns out my grades pretty much stayed the same, even when I stopped getting up so flipping early every morning and staying up all night studying. So that was the first test. Now, fast forward. I'm kind of thinking about psychiatry as a specialty. I really enjoyed my rotation, but I'm working the emergency room. So I pretty much had plans to become a psychiatrist, but then I have to do this rotation in the emergency room, and it was crazy, man. You know, we'd have gunshot wounds in one room. We're having to sew people up, put chest tubes in. The next room over, I have to pull something out of this guy's ear. I go to pull it out. The thing starts flapping its wings. It was a bug inside his ear. And in the next room over, I've got a guy convinced that his girlfriend's pregnant because he is having morning sickness. You know, you can't make this kind of stuff up, guys. The ER is a beautiful place, and everyone should have to spend a 12-hour shift on a full moon in the emergency room at least once in their life, because you learn all kinds of things. Now, to top it all off, my attending, which is basically the doctor who was teaching me on this rotation, he was a character. Let me explain him, okay? So he would wear these khaki cargo pants, these big brown cowboy boots. He'd have a scrub top draped over his beer belly, tucked into his pants, all right? And he would have all this medical stuff in the cargo pockets, like stethoscope, prescription pads, scissors, duct tape, whatever he might need. And then to top all that off, he had the biggest, bushiest handlebar mustache you've ever seen. The dude was a character. But I mean, super confident, skilled. When he was working, you felt good. And he really kind of put me out there, teaching me things. He would let me do all kinds of stuff. If I didn't know something, he would teach it to me. If I felt decent with it, he just let me run with it. And I really felt like I came to my own, you know, and I just loved the chaos of the ER. And so I decided that maybe psychiatry wasn't the right fit because I didn't want to give up the blood and guts of medicine. But I didn't want to just completely do emergency medicine either. So I decided to do family practice, because with family practice, you kind of have a balance. You can, be in the clinic. You can do some psych work. You can do some ER work. You got a little bit of everything. And so I decided to do that. So we made some commitments. I applied to the residency program in Tupelo, Mississippi. I got in, bought a house. My wife had a job, but I was still kind of finishing up medical school. So, but we had all that lined up. And then my last rotation, medical school, addiction psychiatry. And I remember the first day I came home and I told my wife, I said, I made a mistake. This is what I should have done. I love it. So let me explain what my job was there. So I was a medical student, but since I was about to finishing up and I had my attending really trusted me, he kind of let me run things a lot. I mean, he oversaw everything, obviously, and had to sign off. But what I did was I took in the patients who wanted to come into the hospital to be detoxed. So depending on what drugs or alcohol they were on, they would detox off of. We would have to figure out, because some things are really dangerous to detox from. You don't want to just stop cold turkey because it could actually kill you or have really severe withdrawal symptoms like seizures or whatever. But some drugs, you're more just going to have like flu-like symptoms, all right? And so we would have to figure out, okay, so what's dangerous? Because I got to keep you alive, one. Keep you alive so I can get you into recovery, two. But I also had to decide, okay, what medical problems you got? Do you have diabetes? Do I need to give you insulin while you're here? Do you have any active infections? Do you have an infected, site from shooting up? Do you have a staph infection somewhere? Do you have pneumonia? Simple kidney infection? Anything that could be throwing things off. Do you have bipolar disorder? That you've been masking with drug use, and now that you're going to be off drugs, are you going to have some serious psych issues that we need to address? And so it's like this full picture. And not only that, man, it was the patients. I just love the patients. I remember this one lady, she was in her 20s, but she just looked so horrible. Her hair was thin. She had no teeth. She was just emaciated from not taking care of herself. Her skin was just like ulcerated, and she had like these scars and pock marks everywhere, and she would just pick at her skin. And I'd look at her chart, and she had been in detox about 7 times in the past 2 years. And she would just, we'd put her in, we would detox her, we'd get her into recovery, she would do okay, and then she would relapse. And then we just repeated the cycle over and over. But she taught me something, she taught me that because she had lost everything. She'd already lost her kids to DHS. Her family had turned their back on her. I mean, she didn't have anything left. And so I don't think she was ever really thinking that she was going to come in one day and we were going to be able to do something and cure her or fix her. She was just holding on, holding on to hope. And we were kind of the only ones left to offer her any hope. But I tell you something, man. Sometimes that hope is all you need. So, I love the addiction rotation, but I've already made commitments to family practice. And there's one thing I've learned is you keep your commitments. And I wanted to do family practice in Tupelo too, because I already knew the people. I loved, the faculty there. It was basically kind of home. I was going to be around my family, so I thought, okay, I'm gonna stick with this. I'm not really sure exactly why, what's in my future, but it's kind of weird how those things work because I just had this sense that I wasn't done with it. But I get into residency, and there's an attending who actually starts using Suboxone there. And it was fairly new in our area, and he was one of the only people to do it. And he got a lot of, there's a lot of resistance, man. And you think you get resistance. Now, 10 years ago, if you were using Suboxone, man, doctors didn't understand it. Everyone just thought you were substituting. You were just, placating an addict. AA, they hate it. NA hates it. And we didn't have many other recovery options for people, to get like counseling and stuff because everybody was just so in that mindset. And I'll do, maybe I'll do another video sometime on AA and stuff because I think those are good programs. But if you've watched my other videos, how these dogmas sometimes prevent people from actually getting the help they need. But anyway, all right, I'm going off on a tangent. Let's get back to the story. So he was using some Suboxone, and I was very interested in it, and so I started to learn from him. And I would have patients that would come in, they would see me, I would, maybe start them on Suboxone. I had patients that I was seeing that maybe another resident had seen in the past. They were on pain meds, and I would say, hey, man, you want to, are you on these pain meds because you don't think you can get off? Is that why? Because we can use Suboxone, get you off these pain pills, get you off the roller coaster. And so we were like transitioning people. And I actually have a patient to this day that I remember, so this is 13 years later, I think, that he got off his pain pills. We used Suboxone, got him off his pain pills. He's off Suboxone. Now, he still has other issues, but he's doing well as far as that goes. So anyway, and he is adamant not to take any pain meds. But, and he's got some serious back issues too. All right. Okay. Back to the story. So I was learning some addiction as I went. And I was doing also some electives. My electives a lot of times would be in psych issues. just so I could learn more, because I knew my practice was probably going to be more psychiatric based when I got out, because I was just kind of really liking that. But still learning I still wanted the blood and guts options. So, so I'm in residency, third year residency. I'm the chief resident, and I get a call one morning. It's from one of my faculty members. I knew something had to be wrong. He said, "Chris, they found John dead this morning." Now, John was a friend of mine. He was a resident. We were training together, same year. And I knew John had some issues, but I didn't know it was like this. And he told me they found him with a needle in his arm. His wife and 4 kids. Inside the house. See, John was a good person. But this woke me up to something. That it doesn't matter how good you are. It doesn't matter if you're religious. It doesn't matter if you have a good job. If you're an upstanding citizen. John was the kind of guy who would light up the room when he walked in. It doesn't matter what your personality is. Addiction doesn't care. And the second thing it taught me was that in the end, addiction will take everything from you. And I felt like this was a battle worth fighting. So when I got out into practice, I started treating patients and started getting referrals. Again, this was 10 years ago. There was resistance at first, you've got patients in there, meth addicts coming in to see you, and they're sitting right next to your 90-year-old lady with their hypertension. Your partners probably don't understand what you're doing or why you're doing it. It almost is like it wasn't something a respectable doctor would do, but I didn't care about that. I was going to do it anyway. And I began to get referrals, and I began to get more patients coming in, and eventually a friend of mine joined the practice, and him and I both continued to treat addiction, to the point where we decided we would open up a separate clinic that was just for addiction. And at first it was just him and I, half a day a week. But eventually we were able to hire more doctors. And now we have a full-time addiction clinic with a full-time counselor. I like to think we're able to offer that flexible treatment options to patients. It's not all Suboxone, Subutex. That's not the only treatment for addiction, okay? But that's what some people need too. And so I don't know that there's a cure for addiction, but I can tell you this, that the closest thing that I've seen to a cure is hope. Sometimes that's all a patient wants. Sometimes that's all you can give. And sometimes that's all anyone needs. Because hope is like a light in a darkness. So, appreciate you guys watching. I'm sure there's other stories I could tell, but I've probably rambled for long enough. If you have questions, comments, concerns, let me know. Feel free to subscribe, guys, and peace.